Assalamu alaikum. I'm Karishma Sanya, speech and language pathologist. I'm going to introduce you who is a speech and language pathologist and to whom they work with. We are in a society where people don't have any idea that with what kind of problems they have to consult a speech and language therapist. Here I am and I'm going to discuss about how many disorders are there like we are dealing with. I would like to categorize this. First of all, I would mention the speech disorders in which we are dealing with the people, for example, children especially, and adults as well. Those are facing difficulty in production particular speech sounds. Fluency disorders are those in which people who face difficulty to be more fluent and they try to speak. They are quite intelligent and they can speak anything, whatever they have learned, for example, different languages, but they have difficulty in producing that particular sentence with the flow, and that is called stammering and stuttering. So there are some other voice related problems in which people may have difficulty in producing that voice which is maybe not adult like, and there are no an adult one, but they are having a voice like a child. And sometimes they had a previous event in which they sang lots of song with so much loudness, and sometimes it happens that there are teachers and for example Kari and different scholars, those who speak so loud with the emphasis on loudness, and sometimes they exaggerate it. So due to that they may have difficulty, and sometimes it causes trauma to the vocal cords, and there is loss of voice, and maybe there is a problem in the pitch and resonance as well. Expressive language problems and receptive language problems. In which receptive language problems, there are people who are having difficulty in understanding the language, especially in children. And in expressive language, people have difficulty in expressing their thoughts, their ideas, their language. For example, they cannot communicate into particular sentence form and the structure of the sentence, and maybe they are having difficulty in written and written and verbal both. In another category of language is social communication problem, in which people have difficulty commenting and asking questions, following different rules of conversations, and sometimes they are maybe having difficulty in storytelling, and it appears mostly in autism spectrum disorders, and sometimes it can be due to an accident of that may cause the traumatic brain injury. So due to that, they may face the difficulty in communication in the social areas. Another one is cognitive communication, in which people have difficulty in organizing thoughts, paying attention, problem solving ability, and planning and programming the ideas and language, and they are maybe having difficulty in remembering. This happens due to stroke, dementia, and traumatic brain injury, because in stroke they are the language areas, sometimes they are infected due to having infarct in the particular area of the brain. Those are responsible for the language, either in the production or in the understanding or comprehension. Speech and language therapist deals with the swallowing issues. For example, we call it dysphagia, and it appears in case of stroke history, or traumatic brain injury, or maybe the history of removal of voice box due to cancer, and oral rehabilitation to the people having hearing issues and they are hard of hearing, for example deaf we call in normal terms, and they are also providing augmentative alternative communication system ASD devices to the people having severe expressive and receptive language problems. They are also providing their services in progressive neurological disorders, and there are some other duties in which speech and language pathologists are working. For example, they are also working in the schools, and they are helping the children, those are having learning disabilities, for example, dyslexia. Speech and language therapists are also working in a way to enhance the communication. For example, in the production of sound, pronunciation, and also with the an improvement of voice quality. To dedicate this video to my teachers, the pioneer of the speech and language pathology services in Pakistan, and those who really worked hard and introduced speech and language pathology services in Pakistan as a very well-known profession now. And they are really producing so many hard-working speech and language pathologists in the Pakistan. So this video is also for my colleagues. Those are working with the speech and language therapy profession. Thank you.